Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, New Technology for Robotic Knee Replacement, presented by Dr. Alexander Saw, orthopedic surgeon with the Washington Hospital Institute for Joint Restoration and Research. Dr. Saw serves as Medical Co-Director of the Institute for Joint Restoration and Research and Medical Director of Outpatient Arthroplasty Program at Washington Outpatient Surgery Center. He earned his medical degree graduating magna cum laude from Thomas Jefferson Medical College in Pennsylvania. He then went on to complete his residency at the Harvard Combined Orthopedic Program and then Joint Reconstruction Fellowship at Rush University Medical Center in Chicago. Dr. Saw specializes in total knee and total hip replacement. Please welcome Dr. Alexander Saw.
Hello. It's my pleasure to speak to you this evening about novel robotic knee replacement technology which can optimize accuracy and improve outcomes in current total knee replacement. This will be an example of some cutting-edge technologies in joint replacement in 2024. And thank you for that introduction. I appreciate hearing about where I've trained and where I've been, but really one of my proudest moments is being able to practice medicine in the hospital where I was born and raised. My father was a head and neck surgeon here for 40 plus years. Our family has committed a lot of time to this hospital and this community. So it really is a proud moment for me to be able to come back and serve that same community. But my focus is on orthopedics, total knee replacement, revision knee surgery, partial knee replacement, and total hip replacement and revision surgery. I have a special focus in minimally invasive surgery, outpatient joint replacement, anterior hip replacement, multimodal pain management strategies, in addition to robotic and advanced technology in hip and knee surgery. So today, we will speak about some of the robotic advantages in current knee replacement surgery. My associate, Dr. Brian Bonner, is also from the Bay Area, Harvard trained, who also focuses on these same procedures. As a brief introduction to knee basics and anatomy, the knee joint is made up of three bones, the femur, the tibia, and the patella, and the cartilage is the white representation in this diagram in animation, and that's what typically wears in arthritis. There are various ligaments and tendons involved around the knee as well. When we talk about arthritis, we're typically talking about the white cartilage on the end of the bone, as you see there. And so what happens with joint arthritis, whether it's in your knee or other joints, is it can wear and tear. It can wear down like the tread on your car tire and lead to the bone exposed beneath, which can lead to pain, limping, swelling, and mainly an impairment of quality of life. So that's what people are typically treating, and that's typically what people are mentioning when they say they have arthritis in their joint, in their knee. This is what it looks like up close in surgery. You can see where that white cartilage, like the end of a chicken bone, is worn, and there are patches where there's just no more cartilage left. That's what causes pain and symptoms and limitations. On x-ray, you can't see the cartilage on x-ray, but you can see the bone, and when the bone gets closer and closer, like in these pictures, you can see here with different deformities of the leg, that is bone-on-bone arthritis, which is typically symptomatic, requiring additional treatments like surgery. The hip joint, even though this is a knee talk, we'll talk a little bit about the hip joint just because they often overlap. People have knee problems, may have hip problems. The hip joint's a little different, and that's not just a hinge, it's a ball and socket as you see here, but because it moves in those different degrees of motion, that whole ball or the head of the femur has to be covered by cartilage, and that can also wear too. So in the hip, when the ball wears down, what happens is they get more pain and stiffness like the knee, and the bottom line is there's unfortunately no cure for arthritis. We don't have a way of growing normal cartilage. We can't replace it. We can't put it back. So when the cartilage of the hip or knee wears down, like a car tire, once it blows or wears through, you do have to replace it. The hip and knee are similar. And on hip x-ray, you can see the increasing severity of arthritis as the cartilage, that space decreases, the bone erodes and gets worse and worse. That's what arthritis looks like on hip x-rays. Now, what is knee replacement? It is really a resurfacing of the knee. Total knee replacement is not cutting out the entire joint. As you can see here, it's really just a metal cap that goes on the end of the upper bone, the thigh bone femur, and a cap that goes on the top of the lower bone, the tibia. So metal caps on the ends of the two bones and plastic in between. Now these knees are resurfaced, but that's what total knee replacement is called. It's called total because it resurfaces the entire portion of the knee, the inside, outside, and front. So on x-ray, you can see here, when it's bone on the left, in the middle, and on the right picture, that's the x-ray of a knee replacement. You can see it's a metal resurfacing of the ends of the two bones and plastic in between, as you can see in the pictures above. Total knee replacement works incredibly well. It's typically somewhere between a 6 and 12 week recovery. Once recovered, you can walk, bike, swim, ski, golf, tennis, hike, and surf. 80 to 90% plus are working well even after 20 years. The durability is extensive and can last 2 or 3 decades. Nearly 1 million total knee replacements are done in the United States every year. That's how common it is, because people are living longer and staying active and want to regain their quality of life. So a very common procedure, one of the most successful in all of modern medicine. Minimally invasive knee surgery, it works even better than traditional knee surgery in that traditional approaches can require even longer recovery. With smaller incisions, less soft tissue damage, you can have quicker return to function, fast recoveries, and earlier return to work or other activities. So minimally invasive total knee replacement can have even better results and quicker recovery. With rapid recovery protocols, things that I put in my practice in 2014, we have patients like this, a 95-year-old man walking a couple weeks after total knee replacement, walking same day, home same day, or next morning, all ages, total knee, total hip, and revisions. People are recovering faster even after major surgeries like total hip and total knee surgery. And again, we'll talk a little bit about hip replacement only because people ask, similar to the knee, once that surface is worn down, you can replace the hip. And this is a Play-Doh example done by a 3-year-old and his mother, amazingly, which shows his understanding of hip replacement, and is not that far off. With hip replacement, you do address the hip joint, you get to the joint, and you can see here in this particular case that it's a model of a posterior hip replacement or a mini posterior hip replacement. It does have to cut through the muscle and soft tissue to expose the hip, but what it does is it replaces the ball and socket. So it's a very common procedure as well, incredibly rewarding in terms of patient recovery to function. But you can see that what this will do is it gives you a new ball and a new socket so that people can regain their quality of life. But again, this is an example of a 3-year-old's understanding of a posterior hip replacement, which is actually reasonably accurate. But you can see, again, you do have to split through muscles to get there. Great end result, but perhaps maybe options and ways to have an even quicker recovery. And that's where direct anterior approach comes in. This was developed by Dr. Joel Matta, a trauma surgeon in LA, and he had this special operating room table. And with that, you can approach the hip with better stability, quicker recovery without muscle cutting. It goes in between naturally existing muscle planes. So unlike the animation you just saw with the Play-Doh, you don't have to cut through muscle, you can go between it. So people can have more precise, more accurate surgery and implant placement and better outcomes and results. So I have the pleasure of working with Dr. Matta. He made me president of his Antria Foundation in 2022, 2023, and we actually wrote his book together last year. And so with that, done a lot of research and presentations on that to help teach others how the benefits of anterior approach. And you can see on the left is posterior approach. It does go through muscle. On the right, it can go in between muscle planes. Anterior hip advantages, again, in summary, can be muscle sparing, better leg length and offset restoration. It's unique in that you have C-arm or X-ray live during surgery for a more precise implant position. It's the only approach where you can do that with less pain, fast recovery, and better hip stability than all of the other approaches. When you look at its adoption, anterior approach has crossed the 50% barrier by hip specialists in 2019. So in the past 5 years, anterior hip replacement has been the majority of the way hip replacements are done in the United States. That X-ray that I talked about, because we can use that during anterior approach, which is unique, we can get X-rays of both hips, both the arthritic hip and the opposite hip. And the benefit is we can do the surgery and then overlay one X-ray over the other for more precision and accuracy. Again, it's the only approach where you can do this because you're lying on your back with anterior approach, but we can get more precision and accuracy as we look at where the hip began, what normal is, and where the hip replacement we reconstructed matches those hips. So unique to anterior approach. And when you look at the benefits, lower rate of all-cause revision, lower rate of dislocation, it's more stable, lower rate of readmission. People recover faster with this anterior approach in large studies. In addition, when we talk about technology, AI technology is available in the hip. So we use this with X-rays. We can feed that into a computer, which can give us real-time alignment and positioning of the implants, leg length, and offset restoration. These technologies are available in our current operating rooms, specifically with anterior approach. And with replacement, you can see people will walk day of surgery, people will go home day of surgery, people recover sooner and faster. These are all patients walking just hours after their surgery at our institute. So the reason I bring it up is because in summary, total hip replacement has almost no risk of dislocation, no limitations of hip range of motion and positions after surgery or precautions. There is a special OR table which makes it unique, and live x-ray guidance during surgery, which makes it unique compared to other hips surgery techniques, less pain, higher function, and faster recovery. Now, the reason I bring up anterior approach is because we're talking about robotic technology and knee surgery. I bring it up because of the rapid growth of anterior hip. Because of all the benefits we described, that's why you've seen that rapid increase and why it is now over 50% of hip procedures in the US for the past 5 years. I believe robotic technology will be adopted the same, mainly because it's the right technology at the right time. So I think the benefits seen with anterior hip is an analogy for what we're going to see on the knee side with robotic technology. And we'll talk about that more. With hip replacement, it is a natural recovery where people feel better and they feel normal. It's easier than a knee recovery. And so with hip replacement, that's really the gold standard of what we're trying to make our knees feel like. Knees are inherently a more challenging recovery with more rehab, more discomfort, and more swelling. So our goal is, as well as knee replacements do, can we make it do as well as a hip replacement, which again, often is described as feeling normal. So there's room for improvement on the knee side. With the hip, there's stability. As I talked about, that stability is crucial to success. That's why anterior hip replacement has its benefits. For the knee, stability is less of a focus. It's really about putting in implants, but there are soft tissue balancing options that I think can improve the outcomes of knee replacement with the right technology. Instability has major consequences on the hip side, but on the knee, it's less obvious. Yet it's a major cause for revision in knee replacement surgery. So things that are obvious on the hip side are not as obvious on the knee side, yet I think the similarities are there, and we can learn from that. Like I said, with soft tissue balance, we achieve that, and that is part of achieving a good hip surgery. But however, there's a lot of variability in knee replacement. Numerous techniques and technologies are available because it's more difficult to achieve a really well-balanced knee compared to a hip. So how can we bridge that gap? On the hip side, there are many different implants, designs, head sizes, neck options, and implants to try to address this. And on the knee side, there are many implants as well. You can see all of these variations, but that's because they're all trying to solve a problem of how can we make the knee more stable and how can we have patients have a better result even faster to match that hip outcome. So the question today is, can robotic knee replacement bridge the gap with more accurate and reliable outcomes for an already successful knee replacement surgery? So I think the answer is yes. On the hip side, anterior hip replacement with the hip AI I talked about and that OR imaging has brought hip replacement to the next level where patients are having superior outcomes and results. I think robotic technology is that option and that way to achieve it in knee surgery as well with even more reproducible and reliable results. So anterior replacement, what it did for hip surgery, I think robotic knee surgery, as you see here, shows the growth in blue. The rapid growth is following. It's only about 15% of the market right now, but you can see the curve's about the same. Robotic technology continues to grow. And what it can do is it can improve our accuracy and improve our precision so people with knee replacement can have excellent outcomes. And we'll talk about it more coming up here. Why robotics in 2024? We live in a robotic based world, technology-based world. You probably have a Roomba or an automatic vacuum cleaner at home. Your car may be self-driving. Even your lawnmowers can work themselves. In the San Francisco airport, you can't even get a cup of coffee from a human being. It's from these robotic arms that will make your coffee for you. This is the world we live in. If this can happen everywhere else in the world, certainly can happen in our ORs. And so indeed, robotic technology is more prevalent in the operating room and specifically orthopedics. It's important for you to know what robotic knee surgery is. It's a tool that surgeons use in the operating room. So it is not autonomous, meaning it's not something that does the entire surgery. The surgeon is still there. The surgeon guides it and uses the robot as a tool to perform the surgery. So we're still in control. The advanced technology allows us to perform a surgical plan and then execute that plan with great precision and accuracy. It's a continually evolving field. Things are always improving, and robots typically were provided by implant companies. So if you used a robot, you had to use their joint implant. But newer technologies have changed, so we have freedom of choice to use the implant we want to with the robot that we want to. And this is a new development. Most facilities have only one robot due to cost. We are actually leaders in the robotic realm of technology and knee replacement, so we have 3 different options. And we're the only surgeons, Dr. Bonner and I, performing robotic knee surgery at our institute here in Fremont. With our differentiating features of our newest robot, this is a handheld wireless robot. So the most advanced technology actually with the company being here in Fremont. It has overhead tracking, it has an open implant platform as I described, and intuitive smart tools with a CT-based 3D planning workflow ahead of surgery. And I'll talk about the advantages of that. But this was all started here in Fremont, and we've done some of the first cases in the world. With a CT scan, what happens is a patient's anatomy can be brought into the computer where planning can happen before the surgery even starts. So we can know the implant size, the position, the alignment. That way we can basically do a simulated surgery even before we get to the operating room. That way we're more prepared and more efficient in the OR and there are no surprises. Furthermore, with the technology, we can assess knee balance and soft tissue balance in the operating room once the robot is prepared for use. And you can see you can take the knee in the OR through a range of motion showing the various gaps and soft tissue balance, things that you could not easily objectively obtain before. So this is an example of the robot monitor giving us information live during surgery, showing us balance through all the different ranges of motion. You can't do this without a robotic technology. We can literally change the surgery by a millimeter at a time or a degree at a time to fine-tune our implant positioning and final knee construct. What are the goals of robotics? Well, we want accuracy, precision, customization, where we can personalize these surgeries to that individual patient, per knee, per person. We want to achieve optimal knee balance and stability and have a more reliable surgery. We don't want outliers. We can use the various strategies and kinematic alignments that we want to as surgeons. We can reduce outliers and revisions. The goal is to give our patients the best and most reliable outcomes. And that's why robotics has been a game changer in knee replacement. We have complex and sophisticated systems. We have the addition of CT and other technologies to make sure that we can plan for individuals' bone anatomy, soft tissue laxity, limb alignment. We can create a plan, but more importantly is we can modify that plan. So during surgery, if we need to, we can make fine-tune adjustments to make sure we have the best outcome for that individual patient. But these robotic tools are needed to have that level of precision. So here's a brief picture and demo of what the robot is. This is, again, novel, and that is a handheld wireless robot. It is the only one of its kind, developed here in Fremont using a CT scan. So before surgery, a patient gets a CT scan, and that information is loaded into the computer, so we can plan and calculate the surgery how we want to perform it. We can then take the patient in the operating room and then assess balance and gaps to make sure we don't need to make any fine-tune adjustments. But this handheld robot tells us exactly where to place our guides and make our bone resections to achieve the best result. We did the first surgeries a year ago in the country here, and this robotic company has now paired with one of the largest implant companies in the world, and we have done the first 50 cases in the world here. So we're actually leading by example, teaching other surgeons this technology, how you can register the anatomy here. And what this is doing is it's telling the computer where that knee is in space. So now the robot can link that CT information with where the patient's knee is in the operating room. That way anything done live correlates to what that robot is planning. So here, based on all that information, the robot can place the pins, help guide the surgery and the bone resections so they're done exactly as planned. And these are all based on that patient's individual bone anatomy by CT and also their soft tissue balance measured by the graphs I showed you before, where we assess their soft tissue balance. So again, you can't do that without these advanced technologies, but you can see the precision is highly accurate and precise. And this tool is used by me or the surgeon in the operating room to achieve those results. So you can watch more on our website. Like I said, if you want to scan this code, you can look at the article that was recently published. We performed the world's first 50+ cases using this novel handheld wireless robotic technology with one of the largest implant companies in the world. So it was done here in Fremont, and we continue to be leaders in that field, teaching others. But you can scan this QR code if you'd like to learn more. But proud to do that here at our local hospital. So in summary, robotic knee surgery and advanced technology for anterior hip replacements here to stay because it can achieve better outcomes and results. It's changing the way we think about both hip and knee surgery. It has the potential for superior outcomes and faster recoveries, which is what we as surgeons and patients want, of course. The demand continues to grow for patients and surgeons alike because the recovery results are so good. It continues to evolve and improve, which is why here we're proud to be leaders in this field, taking on new technologies and bringing them to our local community. And only certain surgeons and centers have experience with robotics and advanced technology. So you have to talk to those surgeons who have experience. Lastly, outpatient surgery continues to grow. It's the new norm. It used to be patients were in hospitals for multiple days, recovering for weeks, but now the majority of patients are able to go home the same day as a major hip or knee surgery, a lot because of these advanced technologies and surgery. So these are just examples of people after hip or knee surgery going home, same day of surgery and feeling much better right away. So it's always great to see these videos. A lot of research and publications and research done on outpatient joint replacement. And lastly, the reason we're here is for our patients. These are just examples of patients getting back to the things that they love, writing testimonials of how they feel. This is what it's all about. Getting people to skydive if that's what you want to do. He's doing it after hip and knee surgery, or squatting with more weight than I can do. I don't know how she's doing that with 2 new knees, or even wakeboarding, water skiing just 6 weeks after double knee replacement. So this is what it's all about, getting people doing the things that they love to do. So I thank you for your attention. There's more information on our website listed here. I hope this gave you a good introduction to the new technologies and advancements in both hip and knee replacement in 2024. Thank you very much.
Thank you, Dr. Saw. We do have a couple of questions. The first question is, what patients would benefit more from robotic knee surgery?
Wonderful question. Some people ask, are these new advanced technologies only for certain people, younger people or more athletic people? Actually, anyone can benefit from robotic technology because every knee is different and every person is different. Whether you're in your 40s or in your 80s, whether you're highly active or more sedentary, robotic technology can put an already successful knee replacement in an even more ideal position with even better soft tissue balancing, which can lead to even improved outcomes and fast recovery. So to answer your question, robotic technology can have benefits in all patients.
Okay, thank you. And our next question is, approximately how long does a robotic knee surgery take?
So knee replacement can take anywhere from an hour to 2 hours, depends on where you go and who does it. I happen to do more hip or knee replacements than anyone in the state of California, and so because of that, we have a lot of expertise. And with that, we can do a minimally invasive hip or knee surgery in under an hour, even with advanced technologies. Now, that's simply because we have more expertise and experience with it, but the literature shows that surgeons who do more surgery or hospitals and systems that do more surgery will have better outcomes. So experience certainly does play a role in that.
And the last question we have is recovery from robotic knee surgery versus conventional knee surgery. How do they differ?
So as you see with anterior hip replacement, right, making such an improvement on traditional hip replacement techniques, having something with muscle sparing, quicker recovery, and that soft tissue balance we talked about lets people recover faster. So really, in this analogy of this presentation, the way anterior hip has revolutionized hip replacement surgery, robotic knee replacement potentially can do that for knee replacement surgery. So people can recover faster. People can get back to doing things they want to sooner, mainly because those implants and the soft tissue balance of that individual are optimized.
Thank you, Dr. Saw, for bringing this important information to us today. This does conclude our program. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.